Hello, everybody. Good afternoon. Welcome to our weekly COVID-19 media briefing with Montgomery County Executive Mark Elrich. Also, our health officer, Dr. Travis Gales, and Dr. Earl Stoddard, who is the director of the Office of Emergency Management and Homeland Security for Montgomery County government. I'm Lorna Vigili, Hispanic Public Information Officer, and I believe members of the media, you'll already have access, permission to record. If you have not received it, ask in the chat to get your permission. And we will also use the chat for the Q&A portion of this presentation. And with that, to you, Mr. County Executive.
Hey, thank you very much. And thank you everybody for joining us today. I'll start, in the bright spot in COVID right now is our cases per 100,000 have fallen to 12.79, which is the lowest since November 4th. And our positivity rate is about 3.58. And in addition to that, Montgomery County reported its smallest daily increase yesterday, 91, since October 20th, when 94 cases were reported. Today, we have 107 cases. The numbers are encouraging, but they're not numbers we want to get comfortable with. And no reason to stop doing all the things that we've been doing. The numbers are coming down. We have seen, a good decrease in the numbers, but we've also been really protective about how we open things up. And county residents have been pretty good about mask wearing and physical distancing. So, it's our behavior which is making it possible for these numbers to go down. In terms of perspective, our positivity rate is about where it was in the better part of the summer, toward the end of July, early August, maybe. Our cases per 100,000 are still a couple of multiples of where our numbers were back then. And so cases of 94 are, more than when we were reporting 40 or 45 cases a day. So we know this is still higher than it was when we made decisions to open. Obviously, we're looking carefully at these numbers. If we continue to see a sustained downward trend, if we can sustain a good floor again, then we'll be talking about moving toward being able to reopen things. We are constantly discussing what are the points when we can make some different decisions than we've made right now. Testing is one of the things we focused on throughout the pandemic, at least from the point the tests were available. Unfortunately, our testing numbers have declined since mid-January. This is a national phenomenon. And I want to please encourage people to continue to get tested. We need to know where the virus is in the community. The more testing we can do, the better able for us to identify hotspots in the county and get a sense of what the risk is of community spread. So it's really important we map this stuff out. So that data is important in helping us devise strategies that'll keep these numbers going in the direction that I know everybody would like them to travel in. Last week, we tested about 5,600 people. That number is down significantly for the numbers that we're seeing at the end of 2020 and the beginning of the year. So we really are hoping that we can push those test numbers back up where they should be. And people need to realize just because there's a vaccine does not mean that testing isn't needed. It's very important. So please don't confuse the vaccine with a green light not to get tested. We want you to continue to get tested. On the vaccine front, the percentage of county residents who received the first dose has nearly doubled in 2 weeks, according to the Maryland Health Department. As of this morning, 10.6% of county residents have received their first dose, and 3.4% have received the second dose. The county has the highest number of we have the highest number of people in the state who've received the first dose of vaccine. And this is a collective effort of the hospitals, the pharmacies, and our local health department. We also have a long way to go. The supply of the vaccine is still not enough to meet high demand. The state has seen some increase in the vaccine, but that increase is not being passed along to either county health departments, and in some cases, even to the hospitals. They seem to be focusing on mass vaccination sites. They've located several of them around the state. They have not put one in Montgomery County. We've asked for it. We have a location identified where people said we could use their property for a mass vaccination site. So we're ready for it if they want to provide it to us. Prince George's County has a mass vaccination site, and I think almost half of the people they vaccinated over there the last time were actually Montgomery County residents. So if we're going to have mass vac sites, they need to be more spread out throughout the state. And my concern is that the state should use its additional supply, which has increased, rather than taking it from county health departments. Our health department continues to be the one place that's focused on vaccinating people over the age of 75 and vaccinating the 1A group, which were the front-facing health workers and public safety workers. So every time our number gets diminished, the guarantee that those many doses will be put into the same people is lost. And if we want to get the group 75 and older vaccinated sooner than later, then we have to have a steady supply of vaccine that can be dedicated to that. Our focus has been on protecting the most vulnerable in the community. And so far, we can estimate about 43% of our estimated 75 plus population has been vaccinated so far. The county health department is not vaccinating people who are 65 to 74. Residents who are in this age group, as well as educators, should look to schedule their appointments through the hospital or pharmacies that are offering vaccines in the county, or one of the state-run mass vaccination sites. This is important when we continue to have, and the state is still trying to fix their software. They've had a couple of false starts. They're running another beta test today. But until their software is fixed, we're getting people who are not eligible registering on the county site for vaccines, and we don't have any way to stop them from registering. And the only thing we can do is when they show up and they identify as being under 75, we turn them away. And if we don't turn them away, then we're going to reduce our supply that's available to the seniors. So if you're in this age group, there are other places you can go to get vaccinated. If you're a teacher, there are other places you can go. The sooner we can focus our doses on the 75 plus group, the sooner our doses will be able to turn to work on the other groups that need to get vaccinated. But there are more doses outside the county health department right now than inside the health department, about possibly up to 10,000 doses going to other private providers compared to the 4,500 we're getting. So there are doses out there. You have to be patient. There is no single registration system or scheduling system. And so this is very haphazard. Again, we've asked the state to simplify registration and to simplify scheduling. There's no reason there couldn't be a single site that a person can go into and register with available appointments. But the county has no ability to do this. I can't require pharmacies and hospitals to vaccinate any particular group of people. I can't require them to schedule through the state, since the state has not made that available. And so this is going to continue to be chaotic until the state fixes their scheduling system and appointment system, so that there's a way to bring some order to this. I understand the frustration of people. I haven't gotten vaccinated yet because I feel like, because I'm not most at risk, that people who are ahead of me should get vaccinated. But if you're in those high risk categories and you are going on every single day trying to get registered for a vaccine, I absolutely understand how challenging that has to be. There are 300,000 of you competing every week for about 15,000 doses in the county. And because people not listening carefully enough to the governor think that everybody's eligible and therefore there are vaccines, you're trying to get slots that don't exist. Again, the state scheduling has not guaranteed us or our partners regular high numbers of doses that we can guarantee that we can schedule 3 and 4 weeks out. If the scheduling system gets fixed, and if the state says that we've got 3 weeks at least of 4,500 doses, we will schedule the 3 weeks, and we're asking them to continue the 4,500 beyond the 3 weeks. The longer we know that we've got vaccine, the longer we can schedule people in advance. And I think a lot of people would like to hear from us and hear us say that we can get you scheduled now. Even if it's not tomorrow, at least you know that you're in the line and you're going to get scheduled at a date certain. Um, this again requires some changes in the state system, but when it's there, we will accommodate it, and hopefully this will happen sooner than later. People who don't have access to the county website need help pre-registering are advised to call the county's vaccine pre-registration assistance line. The line is available 7 days a week, 8 a.m. to 6 p.m. And the assistance number is 240-777-2982. This line's to assist people who are having trouble with pre-registration online or don't have access to a computer. This line is not the place to call with questions about where to get vaccine. If you know somebody 65 or older that does not have a computer, please help them register, particularly in our Black and Latino communities. Again, we've said this before, they have been the hardest hit by the virus, and they are lagging behind in terms of getting vaccinated. There are historical reasons for that. There are technological reasons for that. But all that said, we have to do everything we can to help make sure that these folks can get vaccinated and get vaccinated soon. We're in a very tough time. The process of pre-registering and trying to find available vaccine is confusing and frustrating. I totally understand what you all are feeling, and we are really working to correct it. We are ready to do this. We stand ready to give more doses. We stand ready to stand up a mass vaccination site. We continue to work with the state, and as they provide more opportunities, we will provide those opportunities to residents in the county. And I thank you for being patient, and I'll just reiterate what I said before. If you get a link, don't share it. Please don't share it. All it's doing is creating chaos at the vaccination sites, and it's frustrating people. And we've got seniors who need to get vaccinated who wind up not being able to get vaccinated. And we get people who aren't eligible yet, and they're getting vaccinated. So work through the channels that can vaccinate you according to where you are in the priority group, and let the county focus on the 75-year-olds for now. We assure you that as soon as that's done, those 4,500 doses will be turned to everybody else in the county. So with that, I'll pass it on to Dr. Gales.
Good afternoon, everybody, and happy Wednesday. And as always, I hope you and your families are staying safe, staying sane, and as best as possible, staying stress-free. I do want to make a couple of comments before we take questions. I want to emphasize what the county executive referenced in terms of the numbers of our cases as evidence of our community transmission levels. The numbers are improving and the trends are moving in the right direction, and they are consistent, even though ours are moving a little bit quicker than other jurisdictions, but they are consistent with what we're seeing across the country in terms of new cases. That does give us a sense of optimism, don't get us wrong, but at the same time, we are cautiously optimistic to continue to see if those trends are sustained, as well as if those trends are sustained in the setting of better weather. The winter storms are keeping folks at home and cutting down on some of the transmission potentially, as also in the setting of potentially increasing percentages of those who are covered by the vaccine, as well as the other point, we are continuing to monitor the presence of variant strains, as the county executive mentioned, variant strains within our community and across the country that have the potential to be transmitted and spread much quicker and faster than the novel strain that was introduced into our communities almost a year ago today. So we will continue to monitor, we will continue to focus on that, and we will look to explore over the coming weeks if those trends hold and continue to move in a positive direction, how we can potentially alter any of the restrictions that we have in place. Now, if you think back to where we were in the summer, we took a very cautious approach that led to us to having much lower numbers than other jurisdictions across the state and the region. And we will take a similar approach in terms of being very careful and thoughtful in terms of how we move forward with reopening in any capacity. because it's important to emphasize that we don't want to open things up and have those numbers rebound, particularly in the setting of different variant strains that are present. We also want to level set expectations for those in the community that, for example, some of those activities that may be reopened with some provisions, such as requiring face coverings to be worn during those activities, at least for the short-term future. So please stay tuned. Please continue to know that we are following those trends and following the best practices that are happening not only in our state, but across the country. I do want to make an update related to, speaking of weather, related to potential vaccine sites tomorrow. We are working feverishly to make some determinations related to that and hope to be able to put information out related to if we need to cancel clinics tomorrow and what types of contingency plans would be put into place. So please stay tuned. We hope to put out some information in the very near future related to that and provide guidance to our residents at home. We obviously want to get everybody vaccinated, but we also want to make sure that we do it safely and it's safe for everybody who's staffing the clinics as well as those who are coming in for the vaccine. We continue to promote equity and access, fair and equal access, as the county executive mentioned, in terms of how we are rolling out our allotments. We continue to explore opportunities to bring the vaccine to community settings. And we have, per the state requirements, we have been providing some doses to childcare workers through our Dennis Avenue site, as well as providing vaccines to different independent living facilities across the county that were not included in the federal-state partnership. So we're getting doses out and we're working to diversify the network of opportunities that people have access to. And we do encourage those, again, who are eligible to pre-register so that we have your information and we can provide you access to the links that are available. I will stop there. I'm sure there are other questions. Turn the floor over to Dr. Stoddard, but happy to address any questions you may have. Thank you.
Gales, welcome back, everyone. Thanks for joining us again. Just a couple things I want to note. In our 75 plus population, we're about to cross the 50% mark. Just to give you an update on where we're at, we're at 48.3% of our 75 and older population across the county who have received a first dose. And obviously, we want to get further into that group before we move into other parts of the 1B phase. Just to give you some context where we're at. The other big thing I want to point out is that we do, obviously with indoor dining opening on Sunday, we had inspection teams out. We're happy to report that we did not find any violations nor issue any warnings or citations from the weekend activities. And so obviously that's something we're hoping to continue with our indoor dining. And as Dr. Gales and the county executive alluded to, we'll continue to evaluate how that, the level of openness that we have in the county moving forward, and we'll continue to inspect and educate and enforce accordingly. Obviously, this is a partnership. Obviously, as we see more businesses doing the right thing and following the rules and able to keep things safe, obviously it encourages us also to be able to do additional openings. And so we appreciate the support that we've gotten from our business community thus far. So I will stop there.
Okay, thank you, Dr. Gales, Mr. County Executive, and Dr. Stoddard. And let's begin with the questions and answers portion of this presentation. First, Chris Gordon. I believe you have questions for everybody. Chris Gordon, NBC4.
Yes, excuse me. We all know that last Thursday there were long lines and waits at Richard Montgomery High School. Some people who were supposed to be in line for whatever reason, 75 plus or healthcare workers, told me they had to wait 2.5 hours in the cold. Today I went by and it was moving very well. People had only the highest regard, said it was 40 minutes to an hour, and they thought it worked really well. Did you make any changes? Have you done anything differently? Are you improving the situation to avoid the kind of disaster that happened last Thursday?
Chris, thank you for your question. As we discussed in our briefing last Thursday, the disaster last week was not caused by the way the operation was run. It was caused by lots of people showing up who were not eligible to get the vaccine, both in terms of who were using a link that was not appropriate, as well as bad information that was put into the community that stated that the site was an open vaccine site. So what caused the significant delays were those two factors. And so we have, again, emphasized to folks how the process works and how it moves through. In every situation, except with the exception of that day, we have not experienced a situation where we've had extensive wait periods and folks standing outside for long periods of times in lines. And I would like to commend the team on that day that included the HHS staff and others who assisted in delivering the vaccines, as well as our colleagues from MCPD who helped diffuse some of that situation and help with crowd control. Is the team actually vaccinated over 1,900 folks that day. And so in spite of those different challenges, we were able to vaccinate a significant amount of people. And also for any individuals who were scheduled to get their vaccine that day, we certainly apologize for that. And if you've had any challenges getting rescheduled or have not been able to be rescheduled, as we did make attempts to prioritize getting those folks in this week, please let us know so that we can get you back in and we can get your vaccine and you won't have to stand outside and wait in line.
I'd only add, Chris, I think it's important context that Dr. Yales gave it. I think the public health team, there was there was lines on that Thursday, but in total on Thursday, we vaccinated almost 4,200 county residents, which I went back and looked, is actually more than 9 health departments across the state had done combined for all their days in vaccination. And so it goes to show how many doses that did go out that day in spite of some of those challenges. Now, I think we all agree that we do not want to see lines like that. And I think the state update to their system will help correct many of the issues that led to those lines. But at the end of the day, that was our most successful in terms of actual putting doses out into people's arms day that we've had since the beginning of this event.
All right, next, Tom Fitzgerald, Fox 5 DC. Tom?
Thank you for doing the call. It's good to see all of you again. Question about schools. A lot of us got a news release yesterday from the Montgomery County Education Association, which says in part that they were passing a lack of confidence resolution. Quote, the current MCPS plan to reopen schools facilities cannot be successfully implemented, requiring more resources, more people, more space, and more time without negatively impacting students' learning experience. This is for Dr. Gales and the county executive. Understanding, what you just said about not wanting to open things up and have things rebound. I guess the simple question is, are they right? Is the plan that's been presented in a position to not be successfully implemented?
I can speak from a health perspective. I'm not privy to those conversations between, union and MCPS and so forth. What I can say is this, is that the guidance that we have provided continues to be the same and is consistent with the metrics and measures that we put out in the fall, using the state guidelines as well as the CDC guidelines in terms of metrics and markers where we thought would be safe to come back related to test positivity and community transmission rate as evidenced by case rates. And the numbers that we have are moving in that direction, which is favorable. What's also different now than before, which again, I continue to emphasize, is that we are seeing teachers and education staff get vaccinated and have access to that. I do think it is important for them to be able to have access to at least one shot before going back into the classroom. I know some may say that's controversial given some of the CDC guidance, but I do think we should, continue to ensure that they have access to that as an added layer of protection when they go into the classroom. Based upon Dr. Stoddard and I we meet regularly with our colleagues at MCPS, and based upon the tremendous amount of work that they have put into planning and, coming up with different provisions and safety measures to put into the classroom to mitigate transmission, we feel that they've done their due diligence in that and to continue to refine. Now, that said, I think, anyone should be concerned, going back into work person to person, but, we do feel that they have put a lot of effort in terms of coming up with different contingency plans and safety measures to mitigate transmission as much as possible. And we will certainly continue to, again, we don't make those decisions. So again, for everybody at home, the health department does not make the decisions whether or not schools open. But we will continue to, again, to monitor our guidance that we have provided to them, based upon the surveillance information we have at hand.
Bruce Dupuy,
I guess-
Maryland. Oh,
yeah.
Mr. County Executive.
Yeah, I mean, I haven't read everything the school system's proposed. I understand concerns about whether, ventilation issues and other things have been adequately addressed, or how many people are going to be in a classroom. Because, as a former teacher, if I had the regular sized class in a regular sized classroom, I would never achieve the separation that people want. So I'd want to look at, how they are going to deal with the number of kids who are brought back into classrooms. And I think the big thing that gets lost in all of this is we talk about Montgomery County as if Montgomery County were all the same. And the truth is, and this is one reason why we've been focused on equity issues, there are parts of the county that do really, really well. I mean, our positivity in cases per 100,000 is the total for the entire county. They are not evenly distributed across the county. You can look at zip codes, and we've got zip code maps, and you'll see far more cases and far more apparent transmission per 100,000. And you'll see other zip codes where you don't see many cases, and you would then extrapolate much lower likelihood of transmission. So I understand that people would look at different neighborhoods and have different concerns about where you were teaching and what's the environment and what's the positivity, rather than just looking at countywide numbers. I think there's something to be said for thinking about that.
Thank you. Bruce Dupuy, Maryland
Thank you.
Matters. You have a question for the County Executive?
Thank you. Two hopefully quick questions. Mr. Executive, I was given some vaccination allocation numbers county by county that I haven't been able to verify yet, but they lead to a question, and that is, are the large counties getting their fair share? And the other question I would have is, do you know how many doses have come into your county to any potential distribution point? In other words, you probably know what the health department gets. Do you know the universe of doses that have come in? Thank you.
Out of my memory, no, but I remember seeing charts that list what we're getting, what the hospitals are getting, and then generic number for pharmacies, but not each individual Giant, not each individual Safeway. The doses at the pharmacy level seem to be pretty low on a daily basis, so it doesn't surprise me that when they open up for scheduling, they close down really, really quickly, because they're not major centers as individual pharmacies, so they do have a fair number of doses. The hospitals have had varying numbers of doses. I know that I think Suburban, or is it Suburban? What is it? Johns Hopkins topped out at one point at about 8,000 doses, and then they're back down in the, I don't know, the 2,000 or 3,000 range. Travis or Dr. Stoddard can correct me on that, but they have not had a steady supply. I think what the governor would do is add up all the doses put together and take our percentage of the state population and tell us we're getting our proportionate share of what they are sharing with counties. Now, out of that, you'd have to take what they're sharing for these mass vaccination sites. And because they're state sites, and like in the case of Prince George's County, a ton of Montgomery County residents are getting vaccinated, they probably would not count them as a particular allocation to a county, since they have a broader availability. But I think that, if they do the numbers, depending how you look at the numbers, they're pretty close to our percentage of people. It doesn't take into account, for example, our percentage of cases and how deeply spread, the virus was here. I mean, we still, I think, top the state, first or second in cases, and first in deaths, I think, over the time period.
Thank you. Albert Myers, MMCTV. Albert? No? Okay, we'll move to Rebecca Tan from the Washington Post. Rebecca?
For Dr. Gales and Dr. Stoddard, what are the biggest challenges or the risks that could hamper the progress that we've made, particularly in the past 3 weeks in terms of slowing the spread of the virus? And then I have another question after this.
Good afternoon, Rebecca. I think the biggest concern is that when you still, if you think back to some of our comments back from the mid to late summer in terms of reopening, when you still have elevated levels, and we're looking at 107 cases and 13 cases per 100,000 as significant improvements from where we were a month ago when we were seeing 600 cases a day, and the cases per 100,000 over 40 is they're still high. And they're still, by CDC definition, still meet high risk of transmission. And the concern is that when you have higher levels of community transmission, even though there are improvements, there's still pockets of the virus within the community, and certainly the presence of variant strains that are more contagious, is that as you open things up, the quicker you do that and you open up more things and activities where you increase the number of people who are coming into contact with each other, there's kindling there to light the fire and have it spread faster. And so, at least from the public health surveillance perspective, that's a huge concern for us. Dr. Stoddard?
Yeah, I was going to say, I think the one big thing that so there's a couple things. I think, first off, let me start by saying that there's plenty of good reason to be optimistic about where we are in terms of not just the county, but the state, the country are moving in a really good direction. With the number of people who've been infected, unfortunately, the bonus of that is that many of those people are likely to have some immunity moving forward. 15 to 30% of the country at this point, depending on how the metrics according to the CDC, have likely been infected. That's nationwide data. You add in that, we've got 10.6% of people who have first doses that have been administered in the state of Maryland. We believe there's probably another 10 or so thousand who have received vaccinations through other states, either Virginia or DC. So we're probably 12 or 13% in all. And so you add those two numbers together, and maybe something like a third of our county likely has some level of immunity to the COVID-19 virus, which is, we're moving in the right direction. Now, as Dr. Gales alluded to, we have these variants that are out there, which we have every reason to believe are going to take over and are more transmissible. And that's going to likely happen over a period of, let's say, the next 6 to 8 weeks. And we just don't know what that does to our overall COVID situation. We have every reason to believe it presents some significant relative risk. But the other big thing that we're really trying to combat is this sense of complacency, because obviously the numbers are getting better. People are seeing the numbers get better. And we want people to understand that the numbers are getting better because of the things that we've been doing, not as an incentive to go do a whole bunch of other things that are going to make it much more risky. And so that's not to say that the county is going to stay. If our numbers continue like this, the county is not going to stay as, we're going to open more things up. That will happen. But we're trying to be regimented about this. Obviously, we just opened indoor dining on Sunday. We'd like to see how that impacts our numbers. We're trying to get our schools back into session, hopefully in March. We don't want to do anything to jeopardize that. We obviously want to see if there's any impact in that. So I think over the next few weeks, we're going to have this conversation repetitively, and I think you're going to see more actions taken from the county side as we see these numbers continue to go down. But we're trying to be pragmatic about this and have it be a regimented, open something up, evaluate, open up something else, evaluate kind of thing, where you're not just rushing to open everything up. Something bad happens, then you can't, assert what the thing was that you opened up that caused, all your problems. So we're just trying to be regimented about how we go through this. We are encouraged by where we are at. There are reasons to be encouraged. There are reasons to have concerns about the future, but we're going to continue to evaluate that on a regular basis.
Got it. And my second question is sort of related to my first, which is, do you think the county will be approaching reopening this time around any differently than it did in the summer and the fall of 2020? And do you want to see the state or the region approach it any differently?
Well, I think it's a fair question. I think, as I alluded to in my opening statement, is that moving forward, there may be some activities, again, that if they're open or reopen in some capacity, there may be some different parameters within which those opportunities can happen. I think of, for example, sporting activities where, in the early stages, they were allowed folks were not required to wear face coverings, and we saw that pop up in, significant pockets of transmission, particularly with youth sports. Potentially moving forward, if those opportunities are opened up again, there may be, tighter requirements around that, to mitigate, transmission from person to person. So I would say those are the types of things that, we're continuing to think through, again, as we have more evidence about the potential risks that are associated with different activities, particularly more data points in terms of how the virus may be transmitted during those spaces. That, again, if they are allowed or reopened, if you will, there may be some tighter restrictions around that in order for those activities to move forward.
I would also add, I think one big thing too is obviously we have some more tools in the toolbox of where we're at than we did when we reopened even late last spring, early summer. And what I mean by that is that not only we think about vaccination as a tool, but we really weren't testing at the level that we are capable of testing at now back then. And so we can connect, for example, more testing requirements to events because we're offering enough testing to allow that to be a component of it. And so obviously that's something that's being discussed in the context of the schools, but also like if you could theoretically have events where you said, we could look at letters of approval, for example, where there was a testing component to allow it to happen. And so there are just more tools that we have available to us that will allow us to be a bit more confident in things that we're allowing to move forward being as well developed. And frankly, we've seen events that have worked. I think that's one of the big things is we've tried some different things. We've seen some things that did not work. We've seen some things that did work. And obviously that will inform how we, we set requirements or even guidelines for how things will reopen in the future.
Got it. Thank you.
Thank you. Next, Dominique Bonesi with WAMU with 2 questions. Dominique.
Hi, County Executive and Dr. Gales and Dr. Stoddard. I have one short one and one longer one, so I'll do my short one first. The county, just to be clear, the county is currently in phase of vaccination, phase 1A and 1B. Is that correct? So we're
County Health Clinic.
County Health Clinic, correct. The state and the pharmacies and the other hospitals are in phase 1C.
That's correct.
Okay, so I'm just kind of curious, how do you weigh telling teachers under 75 years old to get vaccinated before they've returned to in-person learning, and teachers having to go to other places other than the county health department to get vaccinated with sort of the number of vaccines that you're seeing right now?
Well, from a health perspective and distribution perspective, it's a question of numbers. And so, we are trying to encourage folks to use as many outlets that are available, that they have access to be able to get the vaccine, and encouraging and emphasizing the importance of it. Right now, again, the challenge we have with the amount of doses that we receive, 4,500 a week, we're trying to get 78,000 individuals who are over the age of 75 vaccinated. We've only, unfortunately, with our efforts and with others, we're at 50% of that. We also recognize that, included in that, we've got teachers, we've got childcare workers, we've got a whole list of other essential employees who requested for consideration as well to be included in that. And so it's just a simple numbers game. And so that's why we are recognizing our efforts to prioritize the older population, but encouraging, for example, if you think back to several weeks ago, not partnering, but helping provide guidance to some of those agencies who are outside of the county operation, who are receiving doses, to encourage forming partnerships with educators from public and non-public schools to be able to offer that coverage. So it's a dicey situation where, again, we recognize the safety parameters. And again, as a health provider, I still encourage educators to have access to the vaccine and as part of going back. But, it's simply a numbers game in terms of the resources we have available to put out. Unfortunately, again, at this point, based upon the allotment of doses that we receive, it is 4,500 doses can only go so far. And so I would say that that's the unfortunate situation where we're in, and we're continuing when we find out new opportunities and have an opportunity to provide guidance to those entities, we are encouraging them to reach out and form those partnerships to increase access to the vaccine to those key cohorts of population that you just mentioned.
Right now, I think for, obviously for MCPS specifically, there are approximately 9,000 employees that they've identified as being needed for their phase 1 reopening, which is the March 15th opening. Based on our most recent reports from the partnership with Johns Hopkins, they've been offered approximately 6,000 appointments to cover that 9,000 employees so far. Obviously, we're a little less than a month away from now, that March 15th deadline, and have that means we have several more weeks to get vaccines in arms. And I suspect that given the current pacing, that we'll certainly have just about all the 9,000 with a shot in the arm by that period of time. And obviously, we're hopeful from a county perspective. We're about halfway through the 75 plus population. The next tier does include educators after we move beyond that 75 and older tier. And we have every reason to believe that over the next few weeks, several weeks maybe, we'll be able to move into that tier and add to what the Hopkins partnership is doing already. And so we think that we're not off of pace from that goal of having at least one shot in the arm for teachers before that 15th deadline. And we're comfortably moving forward with it now.
I'm sorry, but there are some schools returning to school on March 1st. Am I mistaken?
There are, and I believe that Hopkins, or not, I believe that MCPS did prioritize many of those March 1st educators in their first cadre in that 6,000 that have already been offered. Certainly, we'll be having conversations with them to verify that, but obviously I even think for that March 1st timeline, it is a smaller number than 9,000 for that March 1st timeline, just so we're clear, much smaller.
Okay, next questions. Thank you. Rosbelly Quinones with Univision Washington. 2 questions. Have you seen improvement in the pre-registration rates among Hispanics? And is the county considering opening vaccination centers in Hispanic communities? Would like to take those questions.
I'll answer the second one. Yes. So part of our effort in reaching out to form partnerships with community entities is to identify venues that are in zip codes that have had a high volume of impact from COVID related to cases as well as fatalities, as well as venues, location from housing sites to community sites, where we do see a high percentage of those communities, however you define them, related to those who've been disproportionately impacted by COVID. So we are, as you can see, I'm in the command center today. We've been working on a host of different strategies to try to address that and hope to be able to announce some opportunities in the very near future.
And question
I would also
one.
say one more point on that. So looking at the demographics, and you can actually find this on our website now. We did launch our vaccine dashboard. You can find that on there. If you click on the 75 and older population, it will actually give you a racial and ethnic demographic breakdown of our 75 and older population. And we're definitely making some positive. This is the area where obviously the health department is focused in that 75 and older population and using an equity lens there. We are actually seeing that the rates of our Hispanic residents, Latino residents is improving in that group where we are trying to make that influence. We have more to go, but obviously the numbers in the 75 and older population look much more like Montgomery County than some of our other age groups do, and that's because we've applied an equity lens to our clinics in a way that some of the other clinics across the state have not. And so we feel like as we move into different categories, we'll be able to make that influence more broadly over additional age categories as we move into our further tiers of vaccination.
Jack Moore with WTOP. Questions for the 3 of you, gentlemen. Jack?
Yes, can you hear me?
Yes, I can.
Okay, great. I think Dr. Gales mentioned this figure, but I just want to make sure I'm understanding. 50% of the 75 and older population, and the total population is 78,000. Is that correct?
Yes, we estimate somewhere between
73 is based on the 2019 census numbers.
And is there kind of another way of looking at the denominator? What about the number of 75 plus pre-registered? Do you have that figure readily available?
I don't, but the number it was in, I believe, almost 90,000, but we have not really duplicated that number yet. So we know that there's multiple registrations. So for example, we know of county employees who have registered their parents, and each of the children did it, so there's 3 different registrations for the same person. So we had to develop a program in our Department of Technology Services to deduplicate some of these, and so we're looking for a better number. Yeah, I think that's sort of where we're at.
And I think I know the answer, but you're nearing 50% now. You say you want to get a little further into that. Is there when you reach a certain percentage, then you will move to the next phase?
I think the expectation is it's not necessarily that we have a magical percentage that we want to hit before we move forward. We want to make sure that everybody who's in that category has had a chance to register for an appointment, whether it's through our site or other sites, before we move forward. Because we recognize that, much like the approach we took in vaccinating those in the 1A category, we're likely not going to achieve 100% before we move forward. But we want to make sure that everyone at least has the opportunity to get access, and then include bringing others, and so we can keep the pendulum moving.
Yeah, so as Dr. Gales and the public health team send out invites, as you start to see the slots slow, or the rate at which those slots are filled start to slow down, that's when you start to have the conversation about of including additional groups into it. And so it's sort of just like I think the governor said, just like you're boarding an airplane, as that line starts to get down a little bit, you're not seeing other people line up, you start to bring in other groups to fill that line out.
Thank you. And one more quick question for the county executive, or maybe Dr. Gales. County executive, I know you spoke about the certainty of doses, and I believe the state had sent out a bulletin saying that basically through March 8th, the county health department, according to their projections, will receive 4,500 doses. So will you be able to plan longer term, or do you still need also those fixes on the appointment links that the state really have to make?
So that'll let us plan up until that's no longer the guarantee. I mean, the week after that, if I don't know I have 4,500 doses, I cannot now plan that week for 4,500 appointments. So we'll plan as far as we can plan, assuming they get their scheduling system fixed. But assuming they get that fixed, we'll plan as far out as we know we're going to have doses for. I mean, before they did the 4,500 for 3 weeks, we were previously told we could get 900. We'd get 900, and so that was our guarantee. 975 people a week was like 1/5 of the doses we were getting, which means that we could only schedule 1/5 of the people. I'd schedule people out 2, 3, 4 weeks in that 975, and they would automatically have to wait, even if I could have moved them forward in the beginning. So we need a regular commitment. I'm glad they gave us, they're committed for 3 weeks. I hope every week they revise the out weeks numbers, so that maybe after the 3rd week, they can either tell us the 4th week's going to be 4,500, or maybe there's enough vaccine around that it'll be 6,000. But if we need numbers enough in advance, we can actually schedule to fill the slots.
So yes, to add to what the county executive mentioned, yes, it does help knowing those allotments. It does allow us to plan, as well as, be able to figure out how we can explore partnerships in the community, as well as provide vaccine to our larger sites that we have available to our residents. The fix in the system, the registration system, is key, because that will allow us to feel comfortable and confident when we send a link out to these appointments that they are going to the people who actually are eligible for them. You can imagine the situation where if we're planning clinics out for a month and we send out a link and people are sending it out to everybody else and it's spreading through the community. Lots of those appointments could potentially be locked up by people who aren't eligible, again, blocking those who were trying to get through the queue faster and quicker so that we can move to the other prioritization groups.
Thank you. Next is Brianna Adikusuma from Bethesda Beat, and she has a question for Dr. Gales. Brianna.
Thanks. Before I ask my question, I just had a quick clarification about what you just said, Dr. Gales. Is the link just going to be a one-use link, or is it something that only the person who has it will be able to use? So let's say someone receives the unique link and they send it to someone before they register. Is it possible that that person could use that link to register themselves?
I believe so. It's a one-time live link that you can click on and register. And once that link has been used to register, it's not live anymore. So, and forgive me if I'm misspeaking. So it helps decrease forwarding it after being used, but you're right, it also creates the parameter and hopefully discourages an individual from sending it to other people, running the risk that they may miss out on their opportunity to register because they've sent it to someone else who did it first.
Right, great, thank you. So can you explain how doses are allocated to residents ages 75 and older? I've had a lot of residents who have emailed me who are over 80, who said that they have pre-registered close to the beginning of when pre-registration opened for that group. Is it first come, first serve with that group, or are you prioritizing by age within that group?
So it's not first come, first serve. There's a host of factors that if you think back to actually the last two briefings we had, Dr. Kroll laid out the factors that we've been looking at, from an equity perspective, thinking about, geographic location, zip codes, to some degree, race and ethnicity, to some degree, age as well. But really taking a look at those factors that have been clearly tied to having a higher risk of exposure to COVID-19. As factors to also think about how those doses are allocated within the community. Now, we did this week make an effort to, as we've continued to move through and to try to prioritize, we did make a decision to say, okay, everyone who's a centenarian in the county, here's a link to the appointment to try to, bring again, to start thinking about age to some degree within that. But, just as to go back to, it's the approach from equity is consistent at using the data that we found throughout the pandemic of those particular factors that increase risk within that age cohort, such as location, zip code, geographic location, race and ethnicity, are the kind of factors that are looked at in terms of how those doses are allotted.
Do you have any updated estimated timeline of when you expect to have 75 and older completed?
No, not at this time.
Okay.
We're trying to, get it through quickly as quickly as we can.
Okay.
I think the best we can say is, I think at this time last week, we were at approximately 36%. And so we've done about, and I say we, this is everyone in Montgomery County who's gone to a site or something like that. We did about 12% of that population. So, and the thing is, as Dr. Gales alluded to, we don't know exactly at what point. We know there's some people who are not going to want to take the vaccine, even among the 75 and older population. We just don't know what that exact number is going to be. So we're planning for it to be 100%, but and everyone will get an offer for a slot before we move into the next group. But will that offer, will we not fill slots fast enough when we make all those offers in 2 weeks, or is it 3 weeks or 4 weeks? I think it's probably the range that we're talking about, but I think we're not sure whether it's going to be 2 weeks, 3 weeks, 4 weeks.
Right. And to clarify, the 43% of 75 and older, that's everyone, not just the county health department, correct?
It's 48.6%, and it's everyone. It's all any site.
Okay, thank you.
And the last thing I would say, I forgot to mention this earlier, is this underscores why we are prioritizing trying to get out into the community aggressively to try to find folks, where they are, to drive this number down as quickly as we can so that we can move to the next phase. Because we are concerned that there are those who are over 75 for whatever reason haven't pre-registered in the system, and we're missing them, and we want to try to figure out how we can get them covered as quickly as we can, to address all of those particular issues that have been discussed on the call, to get the penetration in that community so that we can move forward to the next phase within that.
Great, thank you.
Speaking of that, the other thing I want to highlight is, because there's weather potentially tomorrow, and we haven't announced our decision yet, as you can see, people are walking behind me, everybody's trying to work through that, is if there are concerns about missing an appointment tomorrow due to weather, please contact us and let us know so that we can, reschedule those appointments. We recognize that, again, we haven't announced an official decision. In the event that things are open tomorrow, which is a good chance it won't be, but in the event that they are, we want folks to understand we don't want them to compromise their personal and family safety to get a vaccine. We will work with them to reschedule. But again, that's in the event if things are open tomorrow and there's no other contingency plan in place.
Great, thank you.
Thank you, Dr.
Any of things
Gales.
are closed, we're going to reschedule you too, just so you don't lose your spot.
Okay. That is the end of the reporter's questions, but there is one more question here in the chat from a county resident apparently. Why is the state pushing against providing Montgomery County with a mass vaccination site given the size of the population?
Excellent question. One, I'm not sure we have a
You'd
great
have
answer
to
for.
call, yeah, I think you'd have to call the governor's office to get an answer on that one.
I think they've indicated that they believe that the Prince George's County site is sufficient to address both Montgomery County and Prince George's County. We vehemently disagree with that stance. Obviously, in the city of Baltimore, there now will be 2 sites, and while we support our neighbors in Baltimore City being well covered in vaccination, both from an equity standpoint and every other reason, we obviously want to see that the county residents have an opportunity as well, and we're actually working with some potential locations in the county to get all of their the basics of like how much power they have coming in and where we would put restrooms and where we would what the flow would be, so that we can give those strategies to the state to say, hey, we've done some of the legwork for you. I think the site is a very good one for doing X amount of vaccine, and we're very happy to help support such an effort. And so I think it really is about, we continue to advocate to the state that we do have a mass vaccination site in Montgomery County that we believe could serve not just Montgomery County, but our neighbors to the north in Carroll and Frederick and potentially even Howard counties could also take advantage of a North County site in Montgomery County as well.
Well, thank you, gentlemen. We're about done for today. No more questions. We'll see you then next week. Thank you, everybody, for joining us this afternoon. Stay safe.
Thank you.